This is a clinic which I have made with lots of passion for patients who are not able to conceive. There are lots of problems which girls face, emotional, physical, and the main cause of this is because they're not able to become mothers. And becoming a mother is a very big thing for a girl. Getting motherhood and having a proper baby prevents them from lots of mental disturbances. When a couple comes with this problem of infertility, the first thing we do is we do all their blood tests, the males and the females, like we do their blood group, their hemoglobin, we look for any blood disorders, we look into their HIV, HCV, HBS, AG, we also see the VDRL. They should have no sexually transmitted diseases, they should have no illnesses when they are going in for this procedure. Sometimes even if they are HIV positive, we can do IVF on them if it is required and if the couple is healthy and if they will follow up with the doctors regularly. Then after that we look whether the tubes are patent in the woman, whether her menstrual cycles are normal, whether she is ovulating normally. If there is any local infection, it is treated. In the male also the semen analysis is done. In the semen, if there is any infection, then the infection is treated. If the count is poor, then we give them some medicine so that the count can improve. If there is no sperm seen in the semen count, then we can do a procedure called TISA, where there is aspiration of the sperm from the testes and we check whether they are sperms. Then we also do ICSI in this laboratory. ICSI is done for very low sperm count or where the motility is very poor, where a normal IVF cannot give them a child. IVF is to be done only if the tubes are blocked. Because what we are doing is we are bypassing the tubes. We are directly implanting the baby into the uterus. The ovum is picked up from the girl. After giving ovulation induction drugs, around 8 to 10 eggs are prepared. Now out of these 8 to 10 eggs, at least 4 to 5 will be good normal eggs. From this, sperms are taken from the male partner. It is centrifuged and after centrifugation, a pellet is formed. This pellet is then used with very healthy sperms to implant the sperm into the egg. Now when this egg gets fertilized in the incubator, it is re-implanted into the mother on the 3rd day or the 5th day depending on the embryo that is formed. It is not necessary that it is age dependent. Sometimes even elderly couples are having good quality eggs and good quality sperms. Many a times it is seen the younger generation has very poor quality eggs and very poor quality sperms. Polycystic ovaries is a big challenge for the younger couples because they are living with a lot of stress. Even the boys are smoking and smoking up and doing lots of things that are destroying the sperm count. The number of laptops they are using, the cell phones that they are using has definitely got the sperm count down. So it is challenging not only for the elderly people, even for the younger generation. Overall, a success rate of 20% is seen for all the patients.
In our country, what is very common is the tubal blockage. And the tubal blockage is because of chronic infection and the rampant infection, irrespective of the caste, creed, religion and the social status, is tuberculosis of the fallopian tubes. Now this becomes very difficult even though the medicines are there to treat this tuberculosis, but only 5 to 10% of them are able to conceive naturally. Otherwise, this particular tubal blockage problem has to be tackled by no other means than advanced reproductive technology and in vitro fertilization, that is IVF or a test tube baby, or ICSI, that is intracytoplasmic sperm insemination or injection, is the only option left for such patients. Unexplained infertility. Now this particular entity, the good part of this particular entity is there is a very high chance of conception if they take the help of the infertility specialist and they are consistent with their treatment follow-up. There is another interesting fact that the couple who is infertile, just by attending or reporting to the infertility specialist, around 40% of them, 40 to 60% of them have conceived just by visiting the doctor and talking, or even with one appointment with the doctor and telling their problem to the doctor. So This particular factor is related to the psychological part of the couple, wherein they feel that their problem is told, they have come to a personality who is likely to solve their problem. By virtue of this faith and connection, this particular couple is able to conceive.
Welcome to the IVF laboratory. This is the lab where we do IVF and ICSI procedures. IVF is most widely used procedure, though ICSI is mandatory to be used only on certain conditions, and that is especially when there is male infertility problems. Going on to what happens in this lab, we have a 10-day procedure of stimulation to the patients, where the patient is stimulated so that we can retrieve more eggs. In a normal cycle, we get about 1 egg released every month. Now, when we use these stimulation drugs, we enhance this procedure so that we can get at least around 6 to 10 eggs from a patient. Because we are doing this procedure in vitro and not in vivo, we have to do this stimulation so that we can retrieve more eggs. Once the eggs are received, we have a hatch that connects the OT to the IVF laboratory, and from the hatch we get the tubes which have the follicular fluid. Once a follicular fluid is given to us, we scan them under the laminar flow using the microscope here, and the eggs are separated from the follicular fluid. These eggs are kept in an incubator, where the conditions in the incubator are pretty much similar to what happens in the uterus. The eggs are placed inside the incubator for about 4 hours before we start the procedure. This gives it enough of time to change from in vivo conditions to in vitro. In vivo is when it happens within the body, and in vitro is when it happens outside the body. ICSI is intracytoplasmic sperm injection, where the words itself describe it is inside the cytoplasm where we inject the sperm. This happens when the sperm count is extremely low and we will have to search for 1 sperm per egg. The condition is called oligospermia, and in this condition the sperms are very, very less, so we do this procedure. It is advised that people go for an IVF or an ICSI depending upon the infertility history, because many people try different ways of getting pregnant, and if you do not know what is the root cause of your problem, I think all the years of trying is a waste. So if you feel that in 2 years or 3 years of trying to conceive, if a patient has not conceived, it is good to go and see a gynecologist and take an opinion. And if the gynecologist feels that you should go for an IVF or an ICSI, might as well give an early start, because younger the age, the higher the success rate. So this is pretty much what happens in our labs, and we strive to do our best so that our patients can conceive.
Generally, there is a notion that this particular IVF or a test tube baby treatment or ICSI, advanced reproductive technology treatment, is prohibitively costly. It was so sometimes back, but recently there have been a very, very good thought and good thinking to reduce the cost and give something known as budget test tube baby treatment or budget IVF, wherein even the common class can be accommodated in the treatment. And many a times at a center like ours at Spandan test tube baby center, Spandan ART center, we have devised and come out with lots of schemes wherein no patient is turned away from our center. The treatment is offered to almost everybody who comes to the center in whatever budget they have. Of course, if there is no budget problem, then one do have the liberty of going in for the best of the medicines, best of the equipments, best of the resolution, best of the other professional expert help and all. But in spite of that, generally overall there is no effect on the result and the outcome of IVF ET treatment if there is budget restriction. So we have something known as budget IVF, budget ART treatment, wherein the common man is also included, and we have various schemes like if the first cycle is not successful, then we give heavy discount and concession because that's how our support system also tries to help us, so that the general aim is to see that this couple is somehow helped and this couple carries home the baby and the bundle of joy. So that is the mission, that is the object, that is the purpose. Because when we do over a large number of cases, then accommodating few patients who are not affording is generally not a problem. It's a part of charity. At our center, that is Spandan Test Tube Baby Center, no treatment is given to the patient without full knowledge of the patient, the husband, the relative, and whosoever is their support system. So a detailed counseling, a good effective counseling is done, and nothing is kept in the dark. It is very, very transparent, and they are allowed to ask whatever doubts and questions they have in mind. It is also known as third party reproduction, wherein besides the couple there is another person involved in bringing about this particular reproduction process. For example, a female, for some or the other reason, her uterus is not there, or her uterus was there but it is totally damaged, or it has got certain abnormality wherein she is just not able to harbor the pregnancy. Now this particular uterus is like a home wherein a baby stays for some time, maybe from conception to 9 months. So if this particular home is not available, then another place or the space or the home or the womb is rented out or taken help of, and that could be it could be the say a relative, or it could be a contract between the particular surrogate mother, wherein she keeps this particular fertilized embryo in her womb, grows it over 9 months, her health is taken care of, a contract papers are signed, and she doesn't have any right whatsoever legally on this baby. It is only that she is given some consideration, and after the birth this baby is handed over to the commissioning parents. That is, the genetically, that is, the egg is from the patient, the sperm is from her husband, and this particular embryo is only transferred in her womb, that is the surrogate mother, and she brings about grows this particular baby in her own uterus womb, and we accomplish a delivery in whatever form safely, and we take care of her, we take care of the baby, and this baby is handed over to the commissioned couple.